Welcome, everyone, and thank you for joining us today for Memorial Sloan Kettering Advancing Our Mission, an update for donors. This series is an opportunity for members of our donor community to hear directly from MSK leaders who are excited to share their experiences, their ideas, and their vision with you. Today, we're privileged to welcome Dr. Lisa Deangelis, MSK's Physician-in-Chief and Chief Medical Officer. My name is Natalia Lopez, and I am the Manager of Strategic Initiatives in the Office of Development. Before we get started, I would like to take this opportunity to thank you, our donors, who are watching and listening today. All of us here at MSK are so grateful for your generosity, partnership, and continued support. You, our donor community, provides our nurses, doctors, scientists, and staff with the resources we need to lead in cancer care, research, and education. We want you to know how much we appreciate you every single day during every single challenge. Now it is my privilege to introduce Dr. Lisa Deangelis, the Scott M. and Lisa G. Stewart Chair at MSK, a neuro-oncologist with expertise caring for people with brain tumors and neurologic complications due to cancer. Dr. Deangelis joined MSK in 1985 and was appointed Chair of Neurology in 1997. A role she held until she became acting physician-in-chief in 2018. After a nationwide search, she was appointed physician-in-chief and chief medical officer in September 2019. Dr. Deangelis leads a staff of cancer experts that includes approximately 1,200 physicians and 4,000 registered nurses. Dr. Deangelis, it is truly an honor to have you with us today. In the next 30 minutes, we will cover a wide range of topics, including MSK's commitment to diversity and inclusion, our response to COVID-19, and our plans for the future. Thank you for taking time to talk to us today.
Thank you, Natalia. And it's a real pleasure to be with everyone this afternoon. And I'd like to thank all of you for joining us, and specifically to thank our many donors for your continued support during these very trying times.
Thank you, Dr. Deangelis. Let's get started. You are the physician-in-chief of a leading hospital in a city that quickly became the epicenter of the coronavirus pandemic. What have the last 4 months been like for MSK's staff and patients?
Well, Natalia, as I think everyone realizes, the last 4 months have been a challenge for everyone in every capacity. And I have to say that it was our team that did an amazing job in managing to take care of not only our patients' cancer needs, but also to take care of our patients who became infected with COVID. And we had to do a lot of shifting of activities in order to accommodate people who were infected with the COVID virus, the coronavirus. And so the first thing we did was develop enhanced testing capacity. And many may not realize, but we were actually the first institution in the city to have a verified test for coronavirus. And then we had to increase our hospital capacity by 50% and could quadruple our intensive care unit capacity. So the team did an outstanding job in reworking our facility in order to take care of our really critically ill patients who needed that intense level of expertise. At the same time, we wanted to pay attention to those patients who were outpatients who may also have become infected with COVID. And because we know that the coronavirus can result in rapid changes in someone's condition, we actually developed a telemedicine and monitoring system whereby we were able to monitor on a daily basis how patients with COVID infection were managing at home to make sure that they were able to stay home and didn't need the additional care of an inpatient facility. So we were able to do that. At the same time, we had to convert much of our cancer care delivery into telemedicine. That's something that's been widely written about in the lay press, and we, like many others, are now doing at least 50% of our outpatient visits are happening through telemedicine.
Thank you. As you just mentioned, with COVID-19 stroke, clinical and research activities were scaled back to keep our patients and staff safe. Can you tell us a little bit more about what is the current state of operations at MSK, and how did our donors help us get to this place?
So this was an enormous challenge, and both on the clinical and the research side. So on the research side, we had to close all of our laboratories. Currently, we are back to about 50% of activity with the plan actually next week to return to 100% activity. Still managing to preserve social distancing, masking, et cetera, for all of the staff as we resume full research activities. From the clinical perspective, we are roughly about 85% back to both inpatient and outpatient activity, still with a very heavy, as I mentioned, virtual footprint, but we're also starting to return to in-person visits in our outpatient environment. And the staff has worked enormously hard to assure that we have a safe and clean environment for both patients and staff. And we have ready access to testing for both patients and staff should there be any issues that arise.
That is wonderful to hear. When you think back to the height of the pandemic and compare that to today, what you just shared regarding MSK's current activities, what makes you the most proud? What do you view as a silver lining in all of this?
Well, before we actually get to that, I just also want to comment, Natalia, you asked me on the last question about what did our donors do to help us get to where we are. I just would like to highlight a few things because we had almost 3,200 donors help us support our COVID efforts. This included our own board of managers, as well as 750 staff members who made contributions to help other staff through financial stresses caused by this pandemic, as well as many donors who also gave not just financial support, but actual supplies and materials that enabled us to meet our mission and to take care of our patients. I'm sure many of you remember that PPE, or the personal protective equipment of masks and gloves and gowns and this sort of thing, was in very short supply early in the pandemic, and many donors came to our assistance in this regard. I would also just like to specifically acknowledge the Fred's team community. Most of you probably don't realize, but I was actually Fred Lebo's physician. And so the New York Marathon is always has a very special place in my heart, and as does Fred's team, and they have been a wonderful group that has helped us through these difficulties. As far as the silver lining, there have been a few, not that I would ever have wished to appreciate them in this fashion. However, I think one of the things was the team was enormously speedy and efficient in converting us to accommodate patients with coronavirus and infection. We learned a lot from out of necessity. The old saying, necessity is the mother of invention, was really true during the height of this pandemic. We transfer so much of our care, and not just our care, but the work that we do here, into the virtual environment. It included our entire clinical research portfolio. We didn't shut it down, but we converted it into the virtual space. And we learned that we could do that, and we could do it with a whole new model that actually enhanced the level of support that we could give throughout the entire network of Mskcc. Some of you may realize, but I suspect not all, that we have an extensive regional care network throughout New Jersey and Long Island and Westchester, where we provide a lot of our outpatient care. And we shifted much of our care into our regional sites, and then of course into the virtual space. So we've learned that we can do things differently out of necessity. Many of those things we're going to retain. Telemedicine will be here to stay, although I think we need a lot of improvements to make it work smoothly. One of the things we learned is we set up a help desk for patients and families to manage the telemedicine visits. So there's a lot more work to do, but I think that we've definitely learned new ways of doing things that will stay with us well past this pandemic.
That's wonderful to hear. There's been a lot of coverage in the news recently about people foregoing cancer screenings and other medical appointments because of the pandemic. Are you concerned this will lead to an increase in late-stage cancer diagnosis when the disease could be harder to treat? In other words, what would you tell people that are wondering right now, is it safe to see a doctor and get treatment for cancer at this moment in time?
This is a critical question, Natalia. And, very recently, Dr. Ned Sharpless, who is the director of the National Cancer Institute, wrote an important piece addressing the reduction of screening. It has been estimated that across the country, cancer screening procedures have been reduced by 90+%. And the termination or delay of screening will definitely result in cancers being diagnosed at a later stage when they're more difficult to treat, and often the outcome is not as good for an individual. So everyone in the oncology community is very worried about this. And I would say it is absolutely safe to see a physician. Anyone who is diagnosed with a cancer should receive the necessary treatment and should not delay in their therapy, because delay can have consequences. And certainly here at Memorial Sloan Kettering, we have done everything possible to create a safe environment. We're able to preserve social distancing. We screen every employee every day. Everyone wears masks. We wear gloves where appropriate, face shields, and we ask patients to wear masks. And so we've really been able to make sure that people get the care that they need when they need it, and to have really minimal exposure to any kind of infection.
Thank you. Now changing the topic a little bit, we have seen that people of color have been disproportionately impacted by COVID-19. There's been a national call to action to advocate for equality, diversity, and inclusion in all aspects of life, including healthcare. Where is MSK on this issue?
Yes, this is a very important issue, and MSK is and has always been deeply committed to health equity, as well as diversity inclusion for our patients and our staff. I would say we have made some progress with diversity and inclusion here at MSK, but not nearly as much as we would wish. We have really undertaken a deep dive to understand how we can do better in this area. We have established multiple listening sessions for all of our staff at every level, and we are in the process of formulating a plan that is guided by what our staff and patients are telling us. So we know that we can do better here, and we're committed to that. And I have no doubt that with the determination that MSK has always had in tackling very critical problems, we will get better in this area as well.
Thank you. Looking at the future, we're so grateful for our generous donors who have helped us navigate this complex time in the world. As you look ahead, what will you tell our donors who are listening right now are MSK's greatest funding needs? As our partners in our mission, how can they help?
So we have been blessed as an institution to have a wonderfully rich network of supportive donors. And I would say our greatest needs continue to be the demands to support our research efforts. This includes everything from basic science research through translational or human-based laboratory research and clinical research, which is the development of novel drugs and therapies, as well as diagnostics. And the need for philanthropic support for research is likely to be greater in the near and medium term future for certain. We are all worried about a reduction in the ability of the federal government to support federal grants, given the increasing demands of all kinds of other support throughout the country as a consequence of this pandemic. We have already seen many foundations that have been heavily focused on supporting cancer research withdraw or reduce their support for research efforts this year because they are feeling the pinch in terms of not having as many resources and as many funds as they've had previously. So the challenge here is going to be, how are we going to continue to advance the science of oncology, develop the treatments of tomorrow without support? And we're committed to trying to do that, and we know that we can meet this demand, but we will need the enormous support and continued help from our many donors in achieving that.
That is very helpful, Dr. Deangelis. As a final question, I would like to ask you something personal. When you walk through the doors, Mskcc doors, the doors of 1275 York every day as a doctor and as a leader, what are you thinking and feeling? What do you hope to accomplish, and what are you most grateful for?
No, I actually do walk through the 1275, our front door, every day as I'm walking into work. And I'm incredibly grateful to be working in this institution, because there is no team that is stronger, more committed, or more dedicated to caring for patients and giving the treatments of tomorrow today to our patients with cancer. I'm incredibly proud of this entire team, and it is truly a privilege to lead them because I learn from them every day on how to do things better. And it is also an enormous honor to be able to work to help patients through some of the most challenging life events that they experience. When an individual is diagnosed with cancer, it is not just the individual who must go through the difficulties of diagnosis, staging, and then treatment. It is the entire family. And we recognize that, and we know the stress that this puts on people and how vulnerable they can feel during this very stressful time. And to be able to shepherd people through that process, get them through it, get them through treatment is an enormous honor. And to be able to help lead this institution and this remarkable professional staff, and I consider all of our staff professionals, in all honesty, is really a great and singular honor. So I'm incredibly grateful to be here in this significant place at this time.
Well, Dr. Deangelis, as a staff member of Mskcc, I am very grateful for your leadership, and thank you for everything you do, because it really matters. Thank you again for sharing your insights with our donors and for having this conversation today. Before we go, I want to once again thank our donors who have watched and listened today. Your support gives us what we need to stay ahead of the curve in patient care and research, like you just heard from Dr. Deangelis. And we are truly so grateful for your generosity, support, and partnership. If you would like to learn more about any aspect of Mskc's mission, please reach out directly to your gift officer or visit giving.mskcc.org. Thank you again for tuning in today. We know this is a unique and complex time in the world, and we appreciate you and every one of you. Take good care and be well.
Thank you.
Thank you.